interconnect a region of over 600 million bridges between our lands.
Hello, I'm Alma Angeles, and you're watching ASEAN in Focus. Today, I have with me our EBC Thailand Bureau's Esther Odanga. Hello, Esther.
Hi, I'm Esther Odanga from EBC Thailand Bureau, giving you the latest news in the dynamic ASEAN region.
On today's headlines. Body parts, twisted, wreckage, and clothing were plucked from waters of the Indonesian capital on Sunday after a passenger jet with 62 people aboard crashed shortly after takeoff a day earlier.
The Philippines has secured 30 million doses of a COVID-19 vaccine developed by U.S. drug maker Novavax.
Today we have our exclusive interview with Mr. Natapano Nopakun, the Deputy Spokesman of the Ministry of Foreign Affairs in Thailand.
We call it the new cluster.
First, 19 Rohingya and a Thai woman accused of housing them have been arrested for illegal entry to Thailand, according to police, as concerns grow about trafficking routes for the Muslim minority fleeing Myanmar. The embattled Rohingya may have long faced persecution in Myanmar, where they are denied freedom of movement and citizenship and lack access to work, healthcare, and schools. Thai police said the latest trafficking operation was discovered this week when the 19 Rohingya were found in a house in Bangkok's Don Mueang district. The group was smuggled into Thailand overland from Rakhine State and was bound for Malaysia. According to an immigration officer who declined to be named, they didn't know what kind of work they would find in Malaysia. They just wanted to get out of Rakhine, he said, adding that the Thai woman's husband, still at large, had promised them jobs. Out of the 19 Rohingya, 7 tested positive for coronavirus and are being treated, according to the officer, while the rest are being kept in quarantine as a precaution. Thailand was thrust into the international spotlight in 2015 during the so-called boat crisis, which saw desperate Rohingya and Bangladeshi migrants stranded at sea and abandoned by their traffickers. Police officers, a high-ranking general, and several politicians were among scores convicted for their role in the trafficking network, which spilled into full view after officials found dozens of shallow graves in hidden camps near the Malaysian border.
Body parts, twisted wreckage, and clothing were plucked from waters of the Indonesian capital Sunday after a passenger jet with 62 people aboard crashed shortly after takeoff a day earlier. Authorities have yet to say why the Sriwijaya Air Boeing 737-500 went into a steep dive about 4 minutes after it left Soekarno-Hatta International Airport on Saturday afternoon. But on Sunday, they said that they had pinpointed the location of its black boxes, cockpit voice, and flight data recorders that could be key to explaining why the plane slammed into the Java Sea off the sprawling city's coast. Divers will start looking for them now, and hopefully it won't be long before we get them, said the head of Indonesia's Transport Safety Agency, Suharjanto Tajono. The search and rescue agency said it had collected body bags filled with human remains as well as debris from the wreckage in waters about 23 meters or 75 feet deep. All 62 passengers and crews aboard are the half-full flight were Indonesian. The count included 10 children. The transport minister said Saturday that the jet appeared to deviate from its intended course just before it disappeared from radar. Sriwijaya Air, which operates flights to destinations in Indonesia and Southeast Asia, has said little so far about the 26-year-old plane, which was previously flown by US-based Continental Airlines and United Airlines. The Indonesian carrier has not recorded a fatal crash since it started operations in 2003. But this accident is the latest in a string of disasters for the country's aviation sector.
Earlier, I was able to talk to Mr. Natapanu Nopakun, Deputy Spokesman of the Ministry of Foreign Affairs in Thailand, and he gave us an update on the current coronavirus situation in the country. Let's listen in. Today, we would like to welcome, and we're honored to have on our show the Ministry of Foreign Affairs Deputy Spokesperson, Mr. Natapanu Nopakun. Thank you very much, sir, for your time and for letting us interview you today. Thank you very much.
Thank you.
Yes, and first we would like to get the situation now in Thailand.
Yes, well, basically, since the 19th of December, there had been a second wave that came to Thailand after a few months of a pause of no serious infections. So on the 19th of December of last year, there was this new cluster that came up in the province of Samut Sakhon, which is actually nearby Bangkok, and it is an area that has a lot of factories and seafood industry, therefore, as well as migrant workers as well. So this new cluster came about on that date, and we call it the new cluster, not the second wave, because it had no connection to the first cycle in the beginning of last year.
Mm-hmm.
And that cluster, however, had expanded and it had spread to around 58 provinces around Thailand. We have 77 provinces, so the majority of provinces were affected by this cluster. Mostly it's from the frankly speaking, from migrant workers who entered the country illegally. So therefore, they were not placed into the quarantine system and things like that. So that was one issue about enforcement. So when some of the illegal migrant workers came in and then went to Samut Sakhon and they were infected and then infected other people. But in any case, we are treating this very seriously. So from the 19th of December until today, which is around 2 or 3 weeks, there had been a new surge, a new high in the number of infections in Thailand.
Mm-hmm.
So since March of last year until January of this year, or today, we have already reached 10,000 infections in Thailand. However, we've been able to delay reaching 10,000 until January, which is quite good, I think, compared to some other countries around the world. They may have reached 10,000 already in the middle or beginning of last year.
Sure.
But in any case, so it affected 58 provinces, and we're in the process of containing this. In the recent days, the past 2 or 3 days, there had been around 200 plus infections per day.
Mm-hmm. Okay. So what is the government doing now in order to stem the curve of the infections?
So for the Samut Sakhon province cluster in particular, we have cordoned off the area and designated 5 provinces, including Samut Sakhon, 5 provinces that are considered the highly controlled zones, or the red zones. And in these 5 provinces, there are very rigid travel restrictions and other measures. So travel restrictions, for example, if you go to and from these 5 provinces, you would have to provide documentation on your reason for travel. Otherwise, you will not be allowed to enter or depart from those 5 provinces. And also, restaurants have also been put in stringent measures. Their closing times have been shortened already until 9 p.m. And then each provincial governor has the authority to issue their own enforcement measures according to the situation of each province.
Mhm. Okay, so how has this affected has it affected your tourism? How has this affected the overall the tourism industry? As we all know, that Thailand is a tourism country.
Since the end of last year, we allowed people to apply for tourist visas because the situation was getting better. So they had been coming in small groups,
Okay.
small group. We had been opening up to that, hoping that this year we'd be able to increase the numbers. But when the 19th and 20th of December came, we sort of like had to rethink about that. So right now, actually, inbound tourism to Thailand at the moment, of course, has not picked up yet fully, even though we allow tourists to come because, of course, they can come and travel to other regions that are less affected. But if they come to the Bangkok and central area and the 5 provinces in particular, and that would still be a risk for us. So for inbound foreign tourists not picking up as yet because of this new wave, and local tourism still kind of like at a standstill right now because we've encouraged people not to travel domestically too much during the New Year's because of this new wave. But hopefully, we think that the new high for this new wave will not last after January. We think that in January, this month, the new wave that we have from the Samut Sakhon cluster will die down. At the peak, there was like 500 or 400 new cases per day. Now it's down to 200 and then around 100 per day. So hoping that in January that will be solved and the new wave will be stopped within January. Then after that, we can continue with domestic tourism and then sort of like international tourism as well. We haven't ever stopped international tourism. We just paused it for a while, and then this new wave suddenly came up in December, so we had to be extra cautious. But in terms of infrastructure and all the measures, whenever we're ready with this, after this new wave is done, we're ready with the infrastructure and the measures to welcome tourists back to Thailand.
Has the government also responded via travel restrictions from countries with the new COVID strain or variant?
Yes, so for example, from the UK, there's a new strain, but we have not barred entry from travel from the UK to Thailand because we have the state quarantine system that's been in place for a long time. And since we have that system, anyone traveling from the UK or from other countries would have to be in the quarantine system anyways from the beginning. So we have not barred travel, but we have instructed our officials to be more rigid in terms of the documentation. And they can actually ask for more documents, additional documents, from those traveling from the UK. Any nationality person, British or non-British, non-UK, traveling from the UK, our embassy can ask for additional documentation, or they can sort of like delay the issuance of the certificate for entry because they have to be extra careful, but not barring or prohibiting travel from the UK. More stringent measures, because I think scientifically we haven't proven yet that the new strain is how different, how more severe it is, and things like that. It's just a new strain, but we're being careful. All of this, of course, without any discrimination for any travelers.
Hundreds of cases of clusters have also been traced to cockfighting arenas, boxing rings, an outbreak that began in seafood markets, as you said. Now, this is also a pastime that is similar to the Philippines, because we have similar culture as well. These places may not practice physical distancing and have poor air circulation. What approach has the government imposed to control these pastimes?
Yes, of course, cockfighting, all these traditional pastimes. And also gray area businesses like gambling,
Yes.
in Thailand. Both of these have been ordered to close in Thailand throughout the country already, because it's prevalent in the provinces, the cockfighting arenas. And the gambling dens also prevalent in Bangkok, of course. Of course, it is illegal, and these dens, like, they just pop up, in a underground area or something. So these gray area businesses and the other things like cockfighting or even boxing stadiums have been ordered to close at the moment. There are actually 25 types of businesses that have been ordered to close in Thailand, including cockfighting, boxing, sports arenas, and things like that, because of this new wave. And the important thing is that if like a Thai person goes to a cockfighting arena or a gambling den, the most important thing is that if found to be infected, we encourage all persons to reveal transparently their travel history or all the information that they can provide to the authorities, and not conceal or hide anything. That's very important. I mean, it doesn't matter if you went to a cockfighting area or a gambling den. I mean, even a gambling den, you might be penalized for going to an illegal place. But that's one matter. A separate matter is that no matter where you went, it's important not to conceal information, to tell us, like, when you went there, or who you were in contact with, and things like that. Not why you went there, but when and who you met, in order to trace the people that you've been in contact with, so we can trace the origin and who it has affected, and do the proper testing for everyone who were in contact with that person who went to a high risk area. Yeah.
The spike in cases. Spike in cases recurred only in the middle of December, right? If I'm not mistaken. How has Thailand maintained a comparatively low spread of the virus? Is it via mass testing, contact tracing apps, mass communications? How did you do it?
Sure. So the new wave, of course, was scary for all of us in Thailand. So I think we used the same kind of mentality since the one last year. We did not do mass testing like other countries. We did active case finding, meaning like specific areas. So, for example, if it's a known cluster found in a cockfighting area or a boxing arena, we go there, or in a particular district, in a particular province, and things like that. So we sort of like use the targeted approach, not the mass testing approach. And it's been proven in Thailand that it's kind of effective and more cost effective as well, rather than mass testing. Still, of course, there have been some cases that were not found through active case finding. It just popped up somewhere. So that remains to be worked on. And aside from active case finding, we also use the application, yes, as you mentioned. So the application that we are promoting is called More Shana. Ma means doctor, and then Shana means win. So More Shana is doctors win. I mean, well, we're all together and we should all win and then listen to the doctor. So More Shana application is encouraged for everyone to download in Thailand. There has been like around 5 million plus downloads already, and we hope for more. But basically, it has helped us keep the numbers, not only in terms of like checking in a place, a venue, so authorities can track, if you went to a venue that was found infected, not only in tracking where people checked in, but also it warns people on the mobile phone as well. Meaning that when you download it, they'll ask you some questions on your risk, to analyze how at risk you are. For example, if you went here, if you travel by public transportation and stuff like that, and then since the smartphone has GPS and you carry it around, it'll have the GPS and Bluetooth technology to record that you travel to whatever particular place. And if by chance you travel with your smartphone with the application and you go to an area which is known to be an infected area, it'll warn you on the cell phone not to go there, or to go see the health authorities if you went there. Things like that. So it's a combination of a lot of schemes that will help people. So I think the awareness is still there in Thailand. It was, as I mentioned, it was like around 500 per day for around 2 days, I think. But the rest of the days, it was 200 new infections per day, 100. And now it's been 200 for a while per day, and hoping it'll be 100 plus per day. So still in like 365 days, not one whole year, but 363 days, 363 days since our first case in January last year until January this year, making it 363 days. It marked the 10,000 a person in Thailand. So we reached 10,000 persons infected in 363 days. But in that number, around 5,000 have already been treated and recovered and discharged. So around 4,000 plus are still in treatment in Thailand to date. And the good thing is the low number of deaths right now. We still stand at 67 deaths until today.
All right. Esther and I will be back with more of the interview with the deputy spokesman of the Ministry of Foreign Affairs of Thailand after this short break.
Welcome back to ASEAN in Focus. We will now continue our exclusive interview with Mr. Natapanu and the current coronavirus situation in Thailand. Let's listen in.
With many travelers now are complaining of repeated COVID tests departing from and arriving at a destination. Does Thailand require a negative result from inbound passengers and another test upon arrival in Thailand?
The documentation for entry into Thailand is kind of rigid, because I think that's what we focus on. So the COVID test, 72-hour COVID-free document that's required, of course, for entering Thailand. We also have the fit to fly document. That's another one, but it's less important than the COVID-free 72 hours. So that's required for entering Thailand, because sometimes what we found was that people are asymptomatic, and then if you don't have all these reassurances, that it might just come up and affect Thailand. And after that documentation, people have to come into the required quarantine system. Upon arrival, we have a test at the airport. And then during quarantine, we have 1 or 2 more tests. So actually, to answer you, I think some people might see it as kind of repetitive, or there's like so many tests going on. But I think that's necessary for us to be 100% sure, because at the moment there is still no sort of like no framework that would certify the different types of testing globally, you see. So for example, if I travel from some country across the globe, which for example might be sorry to say, but like a developing or underdeveloped country, But so how can Thailand be sure that the COVID-free test, 72-hour COVID-free test you took in that country, is of standard, right? So if I travel from a less developed country, for example, somewhere far away, and I took that test, and then the Thai embassy grants me the certificate of entry, that's fine, okay, but just to enter, right? But how can I be sure that that medical facility in that XXX particular country is of standard in terms of COVID free testing? So that's one thing. But anyways, they allow me to enter, for example, hypothetically. So I'm allowed to enter with the certificate of entry with that thing. And then when I come to Thailand, to be sure, we have our own test at the, for foreign diplomats, we have them at the airport and have them wait for the result. So even for non-diplomats, for ordinary public, the general public, we have to do that as well. So aside from the testing at the within the quarantine system, that makes us sure. And if that person or myself is found to be COVID positive while I'm in the quarantine system, of course I won't affect anyone because I'm in the hotel in the state system, and I can be sent directly to the hospital quarantine. So it's like another layer for reassurance because of the uncertainties that we have in public health standards around the world, frankly speaking. And I think that's necessary because every country has different types of health standards, right? Even today it's even more relevant. So I'm not saying that Thailand has a good public health standard compared to other countries. Other countries might be better than us, but other countries might still be developing in terms of health standards. So we have to be double, triple sure that these documents are valid, and even though the documents are valid from whatever particular country, the health standards there as well have to be double checked here in Thailand. And even here in Thailand, we have to be double checking ourselves as well. So after one test, sometimes there's like a false positive. So even though one facility in Thailand says it's positive, when they double check again, it turns out to be negative. So we have to be double checking ourselves here as well. So I think that's the reason behind why there's this procedure. It might sound repetitive, but it's necessary for us. And I hope that everyone traveling to Thailand will understand this, to keep our numbers low as they are now compared to other countries, even though it's like 10,000 now, but still kind of okay. I think within the ASEAN region for our population, for the size of our population, I think it's not that high yet. We have the percentage. I spoke about the percentage the other day on like the analytical side of it, that most infections now in Thailand are local transmission, more than those coming from abroad. So we have to keep a tab on that.
Mm-hmm. Did the government partner with a private firm to provide app tracking and COVID location-specific advice for Thai citizens?
Yes. We had actually there are around 4 applications for different purposes, but the main one is Moshana, as I mentioned. There are others for foreign visitors in particular, with the kind of field information that's particularly relevant to them, and then there are others as well. But the main one we use now is Moshana. But yes, we collaborated with private sector, a number actually, dozens of private sector people in the tech industry, in the medical, all kinds of industries to help develop this. But the main agency doing it, of course, is the Ministry of Digital Economy. We have a ministry by that name.
Okay. Which government agency heads the coronavirus response in Thailand? Here in the Philippines, we have the Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF. In Thailand, which heads the coronavirus response?
Okay, so we set up a central agency, which is the CCSA, the Center for COVID Situation Administration. The Prime Minister is the chair, and under that, the main agencies are Department of Disease Control of the Health Ministry, and there's also the Interior Ministry, which under the Interior Ministry there's the Disaster Prevention and Mitigation Department. So like for national response, that national disaster. So it's a combination of many agencies in Thailand.
Sir, before I let you go, there's a pahabol na tanong here. There's a last question here from our minister in Thailand. He wants to ask you, sir, kindly ask Mr. Natapano, how will the vaccine be available to expats? Will it be covered by insurance or social security? Is there a possibility po to shorten the process of those work permit holders when they come back to Thailand? And will the visa amnesty be extended po since emergency decree is extended too?
Okay. Thank you. That's a barrage of questions from my diplomat colleague somewhere here in Bangkok, nearby. The last question first. The immigration department is considering that. I can't say for sure, but I would say that most likely it will. There would be consideration on that because last year we said that there might not be no more consideration or extension because it's been extended for 3 times already, right? But with the new wave, that causes a new criteria for consideration. But all in all, it would be up to the immigration people. I can't say yet. The last batch of those who were supposed to return actually probably had already returned. Those who had visas expired already, so they should have already returned. But so I can't say for sure yet. But it's a new criteria. If it's not extended again, then I think travel outbound from Thailand, I think that's still possible. That's not difficult anymore. The travel to and from Thailand is not as difficult as in like the middle of last year. So that's the immigration thing. I can't say for sure. You have to wait for the policy on that because the emergency decree has been extended until end of February. So there's still a month ahead. The second question was the duration of time for certificate of entry, right? I think. Yeah. So I think it takes a number of time to issue. That because, as I mentioned, we have to be quite more rigid now in the documentation. But I think there are just a few countries around the world that our embassies have an issue of backlog with. For example, the UK, because there are many Thai nationals there. Then after that, of course, we issue a certificate of entry for Thai nationals to return, and then of course the foreign nationals already. Whereby I think around over 60,000 foreign nationals have already returned to Thailand. Those who are working here and whatever. So 60,000 foreign nationals have already returned. So if you're not traveling from the UK, I think the process will not be that long. Right now we've changed sort of like the approach. If you're traveling from the UK, the restriction might be more rigid, but not if you're traveling not from the UK back to Thailand, then I think it won't be slow. We've changed the approach, meaning in the past, embassies had to send the information to headquarters to approve, but right now that's not relevant anymore. Embassies can actually approve and use their own judgment in terms of all the documentation. So I don't think it's going to be that slow. Okay, and the first question was about vaccines, right? Yes. So we've been in touch with a number of companies. The procurement plan is one thing, of course. We've been in touch with 3 or 4 companies, and the transport of vaccines, that's another plan. So in February, we'll have a number, February and March, around 1 million doses from the Chinese brand. And then around May, we'll have around like 26 million doses already from AstraZeneca. And then we'll buy more from AstraZeneca, around 30 plus million more. So that's about 50 or plus, almost 60 million doses already. Our aim is to have around 70 million doses for half of the number of population in Thailand. Mm-hmm. So that's, if it's 70 million doses and it's 35 million doses, that's on half the population in Thailand, because one person has to get 2 doses, right? One person has to be shot twice. So 70 million is actually 35 million people only. So that's half the population. So that's our aim, and we're buying, and we call it actually I wrote about this. Vaccine diplomacy. So we're using vaccine diplomacy to open up doors and talking to companies and governments to reach that goal of 70 million doses for 35 million people, half of our population. And it'll come in groups and tranches until starting in February, as I mentioned, until May and beyond. Now for foreign expats and nationals, that's the procurement plan. But the distribution plan is still under works. The distribution plan is still being discussed. The first priority would be medical personnel, those at risk, like old people, those who have sicknesses, and medical personnel. That's of course the priority first. Now the number of expats and foreign nationals in Thailand is not that high, actually. I mean, frankly speaking. So the trend is that in the discussions that I've heard, it will be that either they will be included, just blanket included at all as people living in Thailand. It's not about citizens of Thailand. There's no discriminatory citizenship in terms of infections, right? As long as you're a resident of Thailand, you're in that group in terms of the word I said population. So the half of the Thai population is 35 million. The foreign nationals are in the discussions. They're included in that group because the number is not that high. But that of course remains to be discussed. But we recognize that like foreign nationals who work and live and have Thai families or migrant labor, they live in Thailand, so they're part of the society. So we look at it as the Thai society, not in terms of nationality. Like if you're non-Thai, you don't get it. No, it's not like that per se. But in any case, we are still discussing the distribution plan with the priority for medical personnel and those at risk and vulnerable groups. The worst case might be that foreign nationals who are expats might have to get it from their insurance, meaning the worst case is that if it's not free for foreign nationals, then they would have to be able to reimburse it from their medical insurance. But it will not happen that there's going to be like a scramble for it in Thailand, because we're one of the safer countries around the world. So it'll be systematic. It'll be a systematic distribution. There'll be a plan for distribution. So in the beginning of the year, I will not be getting it, for example, because I'm not a medical personnel. I'm not on the ground in terms of medical personnel, or I'm not a vulnerable group or in the sick people's group. So I myself won't get it, but I'm still confident because in Thailand the numbers are not high, and I take the necessary precautions that we've been talking so much in Thailand, like these masks, and we call it DMHTT. And my embassy, Philippine embassy colleague should know what this means. Of course, DMHTT is the short acronym for our policy here. It's D is distancing, M is mask wearing, and all those things. T is there's about checking about temperature, and things like that, and social distancing, avoiding all those things. So DMHTT is the acronym that we use for this. So I think for the vaccines for foreign nationals, people won't have to worry too much. The distribution plan will most likely include them because that's our outlook to have all people living in Thailand be safe.
Do you have any message for us? Thank you for your time, sir. Do you have any message for us listening to you right now here in the Philippines and around the ASEAN region, around the world?
Sure. So for Thailand, we are kind of in this new wave. We hope that we will be able to stop the new wave. We don't want to be too confident, but then we really want to stop this. We hope that if your country in ASEAN or around the world is facing a new wave, a second wave, if you've passed it already or not, we hope you the very best and more power to help solve it within your country. And of course, international and regional collaboration is going on within the ASEAN region and internationally as well, bilaterally as well. In Thailand, we've assisted some countries, less developed countries, in terms of equipment as well. And I'm sure that many countries are exchanging information, and the people in various countries are giving encouragement and inspiration among each other as well. So my message is that please continue on. Please have more power. Don't lose faith in the power of our unity of humankind. I mean, we face challenges at different times. Our new wave is now. Yours might have been last year already, or still, increasing this year and everything. But please continue to have faith and give hope and inspiration to your neighbors in the ASEAN region and around the world. And hopefully this year, let's stave off and destroy COVID and stop COVID once and for all together.
Hopefully with continued vigilance and cooperation among ASEAN nations, we could better lower the coronavirus spread and distribute the vaccines, as you say. Thank you very much, sir, for your time. I know that you're a busy, very busy man, and yet you gave us this time to have this interview. Thank you very much, Mr. Natapanu.
Thank you. Salamat, mabuhay, and have a nice day.
Thank
More
you.
power.
We'll have a short break. ASEAN in Focus, we'll be right back.
It is now time to build confidence. Obviously, we reached a stage wherein the situation has affected all aspects of life. We are overwhelmed by the flood of information all around. This has in effect created a sense of uncertainty and put all of us in a vulnerable position. But we must not allow COVID to take away the very way of life of our citizens, nor take away the hope from us that we will overcome this together. There is no such thing as too much caution or too much preparation, and therefore we must be fully prepared. For all of us, the global COVID crisis revealed three fundamental issues that are common challenges. We ask ourselves, how will we be better prepared, provide stronger frontline support? How do we build more robust coordination in all fronts? How do we keep our guard up in the months ahead and balance life in the new normal? And on sufficiency, how do we adjust ourselves to live without the overindulgence of the pre-COVID world? And there are underlying challenges of producing a vaccine, of boosting the post-COVID economy in the long term towards a future of global sustainability. Fighting COVID is now a global social responsibility, not only as citizens of your own countries, but as citizens of the world. It takes leadership and sacrifice and discipline from all of us. It is often said that in times of crisis, the true character of a person is revealed. We will together show the world our character. Have faith in each other, and wherever you call home, let's re-emerge stronger and better. We've learned many lessons, and next time around, we hope to improve and take crisis communication to a whole new level. This is all I have for the English language summary of the daily press briefing for today. We'll see you again on Monday. Have a very pleasant afternoon. Please keep tab of the news and the announcements over the weekend. So hope for your full cooperation until then and beyond. So thank you very much. Sawasdee krap.
Back to more news. Around the ASEAN region, the Metropolitan Manila Development Authority, or MMDA, welcomed the appointment of former Mandaluyong City Mayor Benjamin Benhar Abalos, Jr. as its new chairman, succeeding the late Danilo Lim, who passed away last week. In a news release today, MMDA General Manager Jojo Garcia said he looks forward to working with Abalos, who is known for the industrial and commercial development of Mandaluyong City. Abalos is a former member of the Metro Manila Council, the policy-making body of MMDA. He is also the son of former Commission on Elections Chairman Benjamin Abalos Sr., who also served as MMDA chairman from January 2001 to June of 2002. He's married to incumbent Mandaluyong City Mayor Carmelita Aguilar Abalos. Abalos served for 15 years as city mayor of Mandaluyong City. He first became city mayor from 1998 to 2004, succeeding his father. He again served as mayor for the second time from 2007 to 2016. He also served as president of the Union of Local Authorities of the Philippines and League of Cities of the Philippines from 2007 to 2010. Abalos, a multi-awarded mayor, has innumerable awards under his name. Last 2015, he was conferred the UN Public Service Award as a recognition to his Project Teach initiatives, a program that provides free services and intervention to indigent children with special needs. Abalos also received other recognitions as mayor of Mandaluyong for 15 years, such as Outstanding City Mayor and Exemplary Humanitarian Service Award and Champion Activist of Children's Rights and Welfare.
The Philippine government, represented by Vaccine Czar Secretary Carlito Galvez Jr., Serum Institute of India or SII, and Faberco Life Sciences Incorporated signed a term sheet on Saturday to secure 30 million doses of COVID-19 vaccine Covovax that will be available starting third quarter of this year. This is a significant milestone in relations between India and the Philippines. It shows that we don't have to look far beyond Philippine shores to find friends who are willing to help each other out, said Kishore Hemlani, founder of Faberco Life Sciences Incorporated, SII's Philippine partner, after the signing with Galvez. SII, the world's largest vaccine manufacturer, partnered with Novavax, a US-based biotechnology company, for the development and commercialization of the Covovax vaccine. The vaccine has the recombinant coronavirus spike protein nanoparticle and a Novavax patented Matrix M adjuvant to enhance the immune response and stimulate high levels of neutralizing antibodies. Covovax is in third-stage trials and expected to be approved for use by international regulators.
A Singaporean woman was sentenced to 5 months in prison on Friday for hiding her meetings with a male friend from coronavirus contact tracers, as she didn't want her family to think she was having an affair. O.B. Hiok, 65, met a close friend, 72-year-old Lim Kiang Hong, 5 times in the weeks before testing positive for COVID-19 in February, but deliberately withheld the information from the Health Ministry's contact tracers, according to court documents. She did not want her family or Lim's family to find out that they were going out so frequently, as she thought that their family and friends would suspect that they were in a romantic relationship and spread rumors about them being in an extramarital affair, according to the court documents. Officials found out about the meetings after reviewing parking records, CCTV footage, call records, and credit card transactions. After she was admitted to hospital with coronavirus, O spoke to Lim on the phone and asked him to keep their outing secret. He then tested positive for COVID-19 in March. In sentencing, Judge Marvin Bay said her reasons for withholding information were selfish within the pressing public interest need to control the pandemic, according to broadcaster CNA. All pleaded guilty to the charge of hindering contact tracing efforts. The maximum punishment is a fine of 10,000 Singaporean dollars or 7,500 US dollars, 6 months imprisonment or both.
In the Philippines, the government has provided close to 30 billion peso financial assistance to over 3 million local overseas workers affected by coronavirus disease 2019 pandemic, the Department of Labor and Employment or DOLE said. Assistant Secretary Dominic Tutay in a laging handa briefing Friday said some 28.8 billion peso under the Bayanihan to Heal as One Act or Bayanihan 1 and the Bayanihan to Recover as One Act or Bayanihan 2 were allocated to extend cash aid to formal and informal sector employees and OFWs stranded here and displaced abroad. Tutay was referring to the department's three major programs, the COVID-19 Adjustment Measure Programs or the CAMP, Tulong Panghanap Buhay sa ating Disadvantaged Displaced Workers or TUPAD program, and the Abot Kamay ang Pagtulong or AKA program. Tutay said 10,000 pesos or 200 US dollar cash aid provided under the AKAP helped 427,000 OFWs. She reported that based on their monitoring, over 4 million workers in the country have been affected by the pandemic.
In Vietnam, Prime Minister Nguyen Xuan Phuc has decided to temporarily suspend inbound flights from countries and territories, firstly the UK and South Africa, that have reported new COVID-19 variants. This is part of the Directive number 01-CT-TTG signed by the Prime Minister on strengthening prevention and control of the pandemic. The government chief assigned the Ministry of Foreign Affairs to work with the Ministry of Health and the Ministry of Transport to work out a list of countries and territories that the new regulations will apply to. The two new variants, which are potentially far more infectious versions of the virus, first emerged in the UK and South Africa. COVID cases in Britain have soared in recent weeks, forcing the government to impose tighter restrictions in a desperate attempt to curb infection rates. In case of uncovering new COVID-19 case, the Ministry of Health, Ministry of Public Security, the Ministry of National Defense and People's Committees of relevant provinces and cities shall have to promptly trace those having been in contact with the case and take necessary measures to prevent community transmissions. Individuals and organizations who fail to comply with regulations on COVID-19 prevention and control shall be strictly fined, according to the Prime Minister. But Vietnam, with a population of 96 million, has just recorded 1,504 cases and 35 deaths, thanks to mass quarantines, extensive contact tracing, and strict controls on movement.
In Malaysia, at least 6 people have died and nearly 50,000 evacuated in the country after monsoon rains pounded the country's east coast, authorities said Friday, causing what residents describe as the worst flooding in half a century. Authorities have stepped up rescue operations after locals complained they had to fend for themselves earlier this week. Heavy rains continued to batter the region on Friday, swelling the number of people abandoning their home to more than 47,000, officials said. Floods hit the region during the rainy season every year and regularly result in mass evacuations, but those in affected areas say these years are the worst in decades. Many roads, including the main expressway that links to the East Coast states, have been closed. The worst hit state is Pahang, where around 27,000 people have been evacuated in recent days, according to the Social Welfare Department. In one village in the state cut off by floods, residents were evacuated in an excavator on Wednesday, while others were forced to swim through deep waters. Adding the complexity of the rescue efforts, Malaysia is seeing a surge in coronavirus cases, reporting its biggest daily rise last Thursday.
And finally, in our news, at least 11 people were killed, including a 6-year-old boy, and scores more were missing after deadly landslides hit Indonesia's West Java province, according to authorities. Torrential rains triggered the disaster on Saturday evening in the town of Sumedang, where a second landslide buried residents, and a rescue team that had been searching for the initial victims, said Banduing Rescue Agency spokeswoman Seni Wolandari. We're still documenting how many are missing after the second landslide because there were many people who joined the original rescue effort, she said. At least one survivor was seriously injured, while 11 people were confirmed dead. Fatal landslides and flash floods are common across the Indonesian archipelago, where seasonal downpours are frequent and relentless. Indonesia's disaster agency has estimated that 125 million Indonesians, nearly half the country's population, live in areas at risk of landslides. All right, Esther, before we go, I would like to greet Tito Rodolfo and baby Celestial, who is always watching ASEAN in Focus. Thank you for watching. Happy watching po. Also to Brother Willen Regalado. And thank you for your pahabol questions regarding the expats during our exclusive interview with Mr. Natapanu Nopakun, the Deputy Spokesperson and of the Ministry of Foreign Affairs in Thailand. Thank you very much po. And thank you, Esther, for joining me today and helping me out, as always.
Thanks, Alma, and that's the latest news around ASEAN. Thank you all for watching. Again, from ABC Thailand Bureau, I'm Esther Adanga, and we live in interesting times.
And I'm Alma Angeles. We live in interesting times.